You are senior house officer in the neurology clinic of the General Medical Hospital. Please read this scenario and to be ready to communicate with Mrs. Sarah Maher. Dear doctor, Mrs. Sarah, 23 years old. She came to the hospital 5 days ago, complaining from monoplegia and monoparesis in the left lower limb. She was admitted in the ward, and all required investigation, including brain CT, was done, and all investigations were normal. Your consultant diagnosed the case as conversation disorder. Her mother, Mrs. Fatma, is waiting outside, and she is sure that her daughter has monoplegia, and she tried to bench and raising her limb, but no response. Your task to explain to Mrs. Fatma the result of investigation and the diagnosis of her daughter.
Okay. Last 3 lines, can you repeat again?
Okay, no problem. Her mom is awaiting the result, and she is sure her daughter has monoplegia, as she tried to bench, shaking and raising her limb, but no response.
What is that? Bench shaking? What is that?
Rising her limb.
Okay.
But no response. Your task to explain to her mom the result of investigation and the diagnosis of your consultant.
Okay. That is Mrs. Sarah Maher, huh?
Yes. The name of the mom is Fatima, and the name of the daughter is Sarah.
Okay, we can start.
Yes, doctor.
Hello, Mrs. Fatima. Good morning.
Good morning, doctor.
Nice to meet you.
Nice to meet you too.
I am Dr. Ghaffar, Senior House Officer in the Neurology Clinic.
Yes, doctor.
Are you mother of Mrs. Sarah Maher?
Yes, doctor.
Are you the next of kin?
Yes.
Do your daughter knows? Does your daughter know that you are coming today to discuss about your daughter's condition?
Yes, doctor.
Did she give permission to discuss about your father's daughter's condition with us?
Yes, doctor.
So, Mrs. Fatima, I'm part of the team that's taking care of your daughter. Do you want anybody else with you to be present during this discussion?
No, doctor. No.
So, Mrs. Fatima, we are here today to discuss about your daughter's condition. Your daughter was admitted here with some problem. Do you have any other things to discuss besides this?
No, doctor. I'm here to know the result of imaging that has been done for my daughter, and also to know what's going on with her.
Okay. Before that, I want to know how much you know about your daughter's condition.
My daughter admitted yesterday in the hospital. She can't move her leg, and I tried to bench her leg and move it, but no response from her at all. And your colleague on duty yesterday admitted her to the hospital, and he told me that he will run some investigation for her to know the cause of this weakness.
Okay. Sorry, I'm writing some information just to help in our discussion, and it's totally confidential.
Yes, doctor.
Before we start, I want to know more about your daughter. Who else is there in the family?
Me only, doctor, and her, me and her brother.
Does she has any other medical problem?
No.
Is your daughter married?
No.
Does she has any partner or anything?
No.
What is the father of your daughter?
What, doctor?
What is the father of your daughter?
Again, please. Again.
Your mother of Mrs. Sarah Mazhar.
Yes, doctor. Father, he passed away 2 years back.
I am sorry to hear that. Do you want to know? So we are here today to discuss about the result of the tests which have been done for your daughter.
Yes,
is that right?
Yes.
What do you expect? What do you expect the findings? Do you have anything in your mind?
Yes, doctor. Her father died because he has extensive brain attack due to increased blood pressure. And he developed right side weakness, and after that we discovered he has blood inside his brain.
I'm sorry to hear that. Okay, Mrs. Fatima, we did the tests, including the imaging of the brain of your daughter, and fortunately, all tests are normal.
So that what is the cause of this weakness, doctor?
If all tests are normal, the blood tests and the scanning of the brain, then we can comment that actually he has no organic disease. He has no serious disease. She has no serious disease. We can't comment like that.
Are you sure, doctor?
as far as the results concerned, I am sure that she has no problem in her brain, but it doesn't mean that she has no other disease. I agree that she has his symptom is realistic. Her symptom is realistic, but the condition called in our medical jargon, it is called conversation disorder. Do you have any idea about this disorder?
No, doctor.
Okay. This may be related to some stress in the family, or maybe related to some thinking process. You know, her father was having the similar problem, and her father was had high blood pressure. So I think she thinks much about this problem, and that's why she has developed this symptom.
But doctor, she is until now, she can't move her leg.
Can you tell me for how long she is having this problem?
From yesterday, doctor.
So we expect that she will recover from this problem, and we'll we can repeat the CT after 24 hours. But from this symptom and from his background social history, we can comment that actually she has no real disease. She has only the condition already I told. This is conversion disorder.
What is the cause of this condition, doctor?
This is, you know, this some sort of stress or some sort of thinking they can bring this sort of problem, and this is temporary. She will improve, and she will be all right.
Yes, doctor. Yes.
Do you have any other concerns?
Yes, doctor. Is there any treatment for this condition?
I can refer to the psychiatric doctor to have advice, and there is one sort of treatment we call it cognitive behavioral therapy. Actually, this psychology doctor, psychiatric doctor, he will explain more about this problem and about this sort of treatment for you and your daughter.
Do you mean that, doctor, my daughter is now is Ahmed?
No, I do not mean that. She has problem, but this is she is not mad, but she has a condition. I told this is conversion disorder. Referring to a psychiatrist doesn't mean that she is mad. Rather, she has some problem with this therapy that I mentioned as cognitive behavioral therapy. I hope she will get rid of this problem.
Yes, doctor. Is there any treatment in the form of tablet for this condition?
Actually, I don't know much about this problem. Maybe if she suffers from some depression, maybe some antidepressive medication will be advised by the psychiatrist. I cannot tell at this moment. Rather, I will refer your daughter to the psychiatrist, and he will decide which treatment he will give. But I gave you an idea about what sort of treatment he can give to her.
Yes, doctor. Yes.
So, Mrs. Fatima, do you have any other concerns?
For the admission in the hospital, doctor, when she will be ready for discharge?
Actually, we will refer to the psychiatrist. She will be seen by the psychiatrist, and then if everything is okay, then we can discharge her. Actually, I will refer to the multidisciplinary team also. They will reassess her, and when the situation is all right, she will be discharged.
Yes, doctor.
So, Mrs. Fatima, I told you that your daughter was admitted as left leg weakness, and she has a background history that her father died of stroke. And I explained to you that actually your daughter is not having any real medical problem, but she has a problem. We call it conversion disorder, and I will refer her to the psychiatrist. And I told you that hopefully she will be all right. I can give you some information leaflet about this conversion disorder.
Yes, doctor.
Yes. So if anybody in the family asks about this discussion, can you tell me what are you going to tell about this discussion?
Yes, doctor. I informed them there is no any organic cause, and this disease is called conversation disorder, and they will refer him to another physician to assess her condition and treat her from this disorder.
Thank you, Mrs. Fatima.
Okay, thank you. Anyone want to add any comment?
Yes, I think he should take more detail about her social history, about her friends, about her job.
Yes.
Does she have any stress from the job, or
Yes.
does she have boyfriend, and does he mix up socially?
Yes, good.
Is there any stressful element, anxiety in the study or the job, whatever she has?
Yes, yes.
And we should give her support, and we should also advise the mother that we should support her. Maybe she is loneliness feeling after the death of her father. And these things are actually main treatment. And if there is no improvement, definitely psychiatry referral can be one of the possibility.
Yes.
And I think he should give more details about this disorder that we call conversation disorder.
Like what?
What is actually?
Like what?
Actually, this disorder means that there is no real disease, but the patient has a feeling of this. We have done all the tests, including the imaging of the brain, and we found that there is no disease. There is nothing to danger. He should congratulate the mother that it's a good news for you that there is no major disease. Though she feels this weakness, this is just for her feelings.
Yes.
So it's a good news that there is no disease. There is nothing to worry about it, but we need to support her psychologically and mentally and socially and all these things.
Okay. Another comment?
Yes. I want to share with you and all the members, respected members, that this conversion disorder should be taken as a diagnosis of exclusion. Before labeling this is the final diagnosis, we should go for the other investigations to rule out stroke. For example, if we take this stroke in young age, so we need to do few more tests. After having all the reports clear, then this diagnosis should be made. In this scenario, how candidate has assessed from CT brain and the informations provided to him that this is finally diagnosed as conversion disorder.
Yeah, I think when in station 4 a diagnosis is given to you, your task is given to you by your consultant, it means all the other diagnosis has been excluded.
Okay.
Dr. Ahmed, please comment.
Okay, I will give my comment.
Right,
First of all, once you got the diagnosis in the scenario, you have to follow the diagnosis. It is a communication, it is not a history case.
Yes.
So that once he informed you the diagnosis is conversation disorder, خلاص 100% this is the diagnosis. This is the diagnosis. And your rule only to inform the mother or inform any member of family or the patient himself by this diagnosis. No need to do more investigation, because if the consultant wants to do any more investigation, he will inform you in the scenario. They need more investigation. So that no need to request another investigation, and here the diagnosis is clear, is conversation disorder. Okay.
Right. I actually I missed that piece of information.
Okay, so no problem. Another comment? First, I will give my comment that you take a long time to inform the patient about inform the mother about the result of investigation. About 4 minutes, you are waiting. So that asking more here, inform here. Okay, you did everything in introduction and also to explore and expectation, but you have to be quickly, not about 4 minutes. It's too much time.
Okay.
Also, you have to explore, inform here clearly, as as your colleague said. All investigations that done for your daughter is normal, and this is agreed news. You have to inform that. You have to, because it is part of the sympathy and the empathy with the patient.
Yes.
And once all diagnose, all investigation normal, that is means there is no any organic cause. And we put the name of disease for this no organic cause. We call this, it is a functional cause.
Yeah.
Okay. So that, and we call this problem as a conversation disorder. That is mean the person have symptoms like organic disorder, but no any organic lesion in the brain is present at the time being. And the person himself, due to any mental stress in his life, convert this stress to physical symptoms.
Yes.
This is the definition of conversion disorder.
Yes.
Okay. After that, after that, you have to explain to her, ask her about any social activity, any social problem, any problem in her life. Just ask her in the last few days she want to sit alone. She doesn't inform you about anything to annoying her, to explore what is the cause of this conversation disorder.
Okay.
Then you will start management plan for this patient. At the time your mother, your daughter, no need any tablet. We will refer for her for another physician. He will help her a lot to discover the cause of this problem and to prevent this problem to come for her again. I mean that the management for your mother, for your daughter, is dependent in you and her, and you have to give her a full support and to manage your daughter kindly and in a special manner, without anger and without any annoyed her. Okay?
Yes.
This is the most important point in the treatment of conversion disorder.
Okay.
There is a lot of treatment after assessed by the expert physician is called psychiatrist. There's a lot of treatment. This treatment in the form of behavior therapy, and maybe she needs psychotherapy session. If this physician maybe he will give her medication if he feels that her condition not will improve with this behavior therapy. Maybe he will add some tablet for her, maybe he will not add. It's according to his opinion. Okay. So that's the
Yes.
missing part to give conversion disorder. What is the definition of conversion disorder? And what is the management plan to put the mother as a part of the treatment to support her daughter and to know what is the cause of this disorder. She may be retired from job. She maybe have a problem with her brother. Maybe she has a problem with her partner.
Yes.
Okay. Anyone want to add anything for us?
I think very nice. Thank you very much. Nice explanation. That's enough.
Okay, thank you. Who will do the next one?
Okay, I will do. Dr. Mubashir Azim, I want to do next.
You will do the next one, huh?
Yeah, thank you.
Okay.